Dr. Calamere.
Thank you, Calicia. Good evening and welcome everyone to New York City Health and Hospitals fiscal year 2021. Hopefully our last virtual annual public meeting. Hopefully we'll see everyone in person in the near future. Before we start the formal program, I'd like to call your attention that we do have interpretation services available. If you would like these services, please call 212-788-3359. Again, for Spanish interpretation, 212-788-3359 para Español. And I thank you all. And I'll introduce myself, Dr. Vincent Calamia. I'm the Staten Island Borough City Council representative on the Board of Directors. I want to thank all of you for joining us, and I'd like to introduce some of the other board members who are here this evening, some of whom I can see. Bob Nolan, who's the City Council representative for the Bronx. Barbara Lowe, City Council representative from Manhattan. Philip Waddle is representing Deputy Mayor Melanie Herzog. Sally Hernandez-Pinheiro, I believe, is joining us. Frida Wong is here. Fenieski Peñamora. Jose Pagan, who's our chairman of the board. And Dr. Mitchell Katz, who is our president and CEO. Also on the panel this evening are Andrea Cohen, our Senior Vice President and General Counsel, and she will be serving as our moderator for the evening, and Calicia Hercules, Secretary to the Corporation. I'd also like to recognize Maria Conti, Director of Constituent Services, who is representing Assemblyman Michael Cusick. She's here in a listening capacity. On behalf of the board, I'd also like to extend our thanks and knowledge to the leadership of our Staten Island facility, which is Seaview Rehab Center. So thank you to Matthew Levy, the dedicated staff of Seaview who provide exemplary service to our public health system and the people we serve. I want to thank everyone who's joining us on this call. Thank you for your support as we strive to provide equal access to safe, affordable, quality care to all. And with that, I'd like to turn the microphone over now to our President and CEO, Dr. Mitchell Katz, to continue with his remarks.
Thank you so much, Dr. Calamia, and welcome to everyone, especially people who are in Staten Island. 1 year ago, this week, our healthcare system admitted its first patient with COVID-19. Our heroic healthcare workers faced the unimaginable. We experienced the same fears, loss, trauma, and anxiety that the rest of our city and our country felt. Fortunately, we came together as a unified system in support of our patients and each other, and we saved lives in every community across the city. We fought COVID hard with commitment, compassion, and innovation. During the first surge, we tripled the number of ICU beds, an accomplishment that we did over 6 weeks that I think would normally have taken at least 2 or 3 years. We did it in order to save lives for our patients. These experiences made us a stronger, more efficient health system. We've been able to manage the second wave of increased cases with more confidence and understanding of how this deadly virus can be fought, and with the effect that we have many fewer losses than we did in the first wave. While there is much hope ahead, thanks to our hard work, we still grieve the friends, relatives, and coworkers that we lost to this pandemic. I want to take this moment to reflect with great pride the contributions made by every single employee at New York City Health and Hospitals, and to thank our community partners for their love and support over the past year. Those 7 p.m. Pounding on pots really lifted our spirits and reminded us of our essential role. The COVID pandemic has shown how necessary New York City's public health system is. Not only did we not collapse under the huge load of COVID patients, but we were able to take care of patients from other hospitals. Thanks to the sacrifices made by our brave staff and their readiness to answer a higher calling over the last year, Health and Hospitals has been there for our staff, our patients, and in all New Yorkers. The next phase is our healing phase. as our hospitals have provided care, we need to recognize that there are many people, both patients who continue to have symptoms from their COVID, who continue to suffer, people who are suffering from the isolation caused by COVID, the inability to engage in the simple pleasure of shaking someone's hand and hugging and being and celebrating birthdays. We want to recognize how traumatized many of our staff were. A doctor, a nurse, always wants to do their very best for their patient. Under the difficult conditions people worked, they did their best, but they also recognized that our conditions were less than ideal, and that made for a lot of lost sleep, myself included. We want to thank all of the New Yorkers for their tremendous donations, $35 million, that enabled us to offer to all of our staff free meals, transportation, clean scrubs, hotel accommodations, and childcare to help ease their difficult days. I'm very proud that following the first wave, we put together the largest test and trace effort anywhere in the United States. And I truly believe it's because of that that our second wave was not nearly as intense as it was in other parts of the country. We slowly, day by day, site by site, grew for our system, and then rapidly towards the last few months, such that we reached 100,000 tests done in one day. Meanwhile, our staff of contact tracers kept people safe by enabling them to know how to isolate themselves within their own home or how to go to a hotel, of which we are currently running 5 hotels for people to safely isolate, where we provide them with meals, childcare, health care. We go and get their prescriptions. We do whatever is necessary to keep them safe. And then now our latest phase has been in vaccinating first our own employees, our nursing home patients, our patients in the hospital. We are very lucky that within a year of that first death, we now have 3 effective vaccines, 3 vaccines that have made major decreases in the number of severely ill and people who have to be on respirators. We've already vaccinated 260,000 people. Meanwhile, our ambulatory care teams are serving more than 26,000 patients who had COVID, many of them with a variety of symptoms. We've opened up 3 new specialized health centers for those people. We also are aware, like all of you listening, on how this pandemic has only worsened the inequalities in healthcare. It's created fissures in almost every part of our society, from the education to the economy. These inequalities, inequities are already having a disproportionate effect on the health of the patients and the communities we serve. That's why we must intensify our commitment to health equity, diversity, and inclusion in every aspect of our work, from clinical care to language access services. So grateful and proud of our staff for everything they've done and continue to do. I want to thank all of you for being with us tonight and for your support of our essential public health care system. I want us to proceed now to the main purpose of tonight's meeting, to hear from you, members of the community. Your input is so important to us, to the future success of the system. I'd like to turn to our terrific General Counsel, Andy Cohen, to outline the proceeding for tonight's meeting. Andy?
Great. Thank you so much, Dr. Katz. Due to the COVID-19 public gathering restrictions, we're convening this 2021 public hearing for the Borough of Staten Island virtually, but though our computer screens may be in different boroughs in the city, our focus tonight is very much on Staten Island. This is the first in a series of 5 meetings that we conduct annually across the city's 5 boroughs. The purpose of H&H's annual meeting is to inform the public on the programs and plans of New York City Health and Hospitals, which you just heard about from Dr. Katz. And then most importantly, to afford the public an opportunity to present oral or written testimony concerning New York City Health and Hospitals performance. All public testimony, whether it's presented orally tonight or submitted in writing, will be transcribed and forwarded to all the members of the Board of Directors for their consideration. And of course, we have many members of the Board of Directors here to hear it live this evening. Just one quick programming note that registration for testimony is still open for a few more minutes. You can call 212-788-3359 if you recently joined this meeting, and it's open until 6:30 tonight. I will be moderating the balance of tonight's meetings, and I'm just going to go over a couple of quick format and rules for the testimony. This is an opportunity for our Board of Directors to hear from the public and to listen to you. It is not a question and answer forum, and there won't be formal responses from the board or from Dr. Katz this evening. This is a listening session to hear from the public. Each registered speaker will have an opportunity to testify for 5 minutes of speaking time. On your screen, you'll see there will be a focus on an electronic timer that will provide warnings about the expiration of your time. A green light will indicate that you're at the beginning of your time. A yellow light will indicate that you have 2 minutes remaining in your allotted time, and a red light will indicate that your time is expired. When it starts to flash, you need to finish your sentence fairly immediately, and if necessary, I will gently interrupt you and ask you to conclude your remarks at that point in time. If you don't finish your full comments in that period of time, don't worry. You can submit any additional materials in writing, and we will provide all of that information to the Board of Directors. And with no further ado, I think we will begin now to go to our first speaker. And our first speaker this evening is the Staten Island Borough President, Mr. James Otto. Thank you so much.
Thank you, and good evening, everyone. It's good to see all of you. I hope you and your families are well and safe. And let me start with a thank you to the entire H&H family for everything that you've done for this city in the last year and during the craziest of times. I also want to shout out to Dr. Katz. I've spoken with him a few times in the last year, and I just want to say that he's confident and calm and rational and responsive. And in my line of work, every now and then you have to throw a sharp elbow at a commissioner. And we try to be as quick in our praise. And Dr. Katz, in my interaction with him, has been wonderful. And I want to publicly acknowledge that. This is the first time in a while that I've testified in person. That's probably a good thing, because over the years, I've had some animated testimony during these hearings. Back in my council days, when I was on the front line fighting for a public hospital, I don't know if the word is ironic, but it's interesting to see that fight is back in the headlines again in the mayoral race. And I see some of the next leadership of Staten Island, David Michael Carr, Michael Schnall, who are waiting to testify, and I'm sure you're going to hear that from them. I will not talk about that tonight. As someone with 290 some odd days left, I have a more immediate goal tonight. I want to kind of go off the board, if you will, and frankly, I want to use this opportunity to place a marker and to put something in the back of your minds that will come before you at some future point. And I want to try to grab your attention without jumping up and down and being animated like the old days. And just bear with me if you can. It's a paragraph from David Sinclair's fabulous book called Lifespan. So just bear with me 1 second. Small and large diabetic foot wounds rarely heal. they can look as though someone has taken an apple corer to the balls of both feet. The body doesn't have enough blood flow and cell regeneration capacity, and bacteria thrive in this meaty, moist environment. Right now, 40 million people, bedridden and waiting for death, are living this nightmare. There's almost nothing that can be done for them except to cut back the dead and dying tissue, then cut some more, and then some more. From there, robbed of upright mobility, misery is your bedfellow, and thankfully, death is near. In the United States alone, each year, 82,000 elderly people have a limb amputated. That's 10 every hour. All the pain, all this cost comes from relatively minor initial injuries, foot wounds. That's a paragraph that hit me hard for a couple of reasons, not the least of which was my dad lost his right leg below the knee, not from diabetes, but I saw the impact on him physically and mentally. A guy who was a workaholic, drove trains all around New York City for 30 years, and what that did to him. It also hit me because for a while now, I've been fighting to get a diabetes center set up on Staten Island. You know better than I probably, they call it a gateway disease. They call it the mother of disease. Some people say it's responsible. Its complications are responsible for upwards of 70% of hospital visits, $51 billion spent in diabetes medicine. In 1960, less than 1% had diabetes. Now you're looking at diabetic and pre-diabetic, a third of America. And I want to do something about it on Staten Island. And I went to my friend Bill de Blasio a couple of years ago when he was stuck in the quagmire of making a commitment to build an indoor pool. He put $25 million on the table. He put $50 million on the table. He put $100 million on the table to build an indoor aquatic facility that became this source of contention. Who wants it here? Who wants it there? And I had a heart-to-heart conversation with my chief of staff, Jason Rosevsky, during a and he said, do you want to win and fight the fight, or do you want to get something done? And I went to the mayor and I said, let's pivot. Let's get out of the pool building business and let's do something with a higher purpose for this money. And I pitched him an idea of spreading the money out over 3 or 4 really worthwhile projects, including a diabetes center on the grounds of the CVU campus. And for the last 2 years, I've been working with the New York City EDC, working more recently with the H&H team. We originally identified the surgical pavilion. We have since switched to the staff house because we want to get a pediatric care facility at the surgical pavilion. We are this close. We have a partnership with Staten Island University Hospital. I don't know if you know him, but Dr. Brahim Ardolik, who runs SIUH, is phenomenal. And so there's some things to be worked out still, but at some point in the not too distant future, I'm hoping that this item comes before you, where we get to start that vision of making health and wellness campus at the CVU campus. And we have a beautiful partnership to create a facility that's going to treat Staten Islanders and prevent Staten Islanders from that fate that was described so well and so poignantly in David Sinclair's book. So I thank you for your time. I thank you for everything you do. Just remember this, at some point, there's going to be something called, a diabetes center. Just please remember it. I think it's going to be something that you all will be proud of. Thank you. Stay well. God bless.
Thank you very much. Thanks for your comments. Our next speaker is David Carr, representing Council Member Mateo, 50th District of the New York City Council.
Thank you so much. Appreciate the time. Good evening, everyone. As was said, my name is David Carr. I'm Chief of Staff to New York City Council Minority Leader Stephen Matteo. On his behalf, I want to echo the sentiments of the Borough President with respect to the work of health and hospitals during this recent pandemic and for helping so many, stay safe and get the treatment they need. Tonight's public meeting is happening in a very different world than previous health and hospitals public meetings. While we're still in the midst of the COVID pandemic, the reality is that planning for a post-COVID world should already be taking place within all governmental agencies. In no other area is this planning more important than in our public health agencies. COVID exposed many inequities within our public health system. Included in those inequities is the relative lack of presence of H&H on Staten Island. We all know that Staten Island is the only borough without a public hospital, and I'm certain many tonight will ask you to construct a full-service hospital in Staten Island. It's an ask that's been made for decades on behalf of Staten Islanders, and it has never happened. Meanwhile, our private hospitals continue to pick up the burden. But that does not mean H&H is off the hook vis-a-vis this borough. In fact, it's the opposite. The fact is we are one of the 5 boroughs of New York City, and we deserve similar services as other boroughs. This must mean greater investments in Staten Island, particularly in primary care, so that we can collectively make Staten Island healthier. In a study recently released, the CDC reported that about 78% of people hospitalized for COVID needed a ventilator or died from COVID-19 were overweight or obese. More than 75%. We know such individuals are also more likely to have other pre-existing conditions such as high blood pressure and diabetes, which puts them at risk of other serious health outcomes. These numbers are eye-opening and show the importance of preventative care. H&H must devise a plan to better serve our borough so that we can make our population healthier and less susceptible to COVID-19 and similar conditions. H&H has a role to play. It may not make up for decades of treating our borough in an equitable way, but it is a start. Finally, I'd like to note the reality of not having a real public health infrastructure in Staten Island. The simple fact is we do not have a sufficient number of sites to vaccinate our population, a problem most acute on the South Shore. Despite being castigated by the governor all fall for our high positivity rate when it comes to vaccinations, neither the city nor the state seem too interested in giving us convenient locations for our residents. The demand is there, the will by government to give us locations is not. If we had a proper public health infrastructure, we would likely have plenty of H&H locations to choose from, and the vaccination process would be easier and less stressful for Staten Islanders. The time to forge a new partnership in public health is now. It is time to seize this moment and right the inequities of the past.
Great. Thank you so much for your comments. Our next speaker is George Marino. He is the chair of the Community Advisory Board for Seaview.
Hello, this is Joe Tornello. I'm a member of the Community Advisory Board. I'm presenting testimony on behalf of George Marino, the acting chairperson of the Seaview Community Advisory Board. First, I want to say just certainly to congratulate or to just express our appreciation to the leadership of Matthew Levy, the executive director at Seaview Hospital Nursing Rehabilitation Center and Home. He's done a wonderful job there. Since the onset of COVID-19 pandemic, Seaview has remained completely devoted to the health and safety of our vulnerable resident population. In compliance with all CMS, CDC, and New York State Department of Health recommendations, as well as New York City Health and Hospitals and post-acute service line guidance, Seaview has continuously acted to limit exposure and prevent the spread of COVID-19 within the facility. Hence, over the last several months, a number of efforts have been initiated as a means of executing and enhancing our infection control and prevention program. The initial response against COVID-19 was focused on awareness and screening of entrance into Seaview. In February, signage was posted at the entrance and lobby areas, informing recent travelers to refrain from visiting if feeling ill. Facility-wide in-services were also conducted on the proper utilization of personal protective equipment, and staff knowledge and awareness of COVID-19 signs, symptoms, and procedures to follow when suspecting resident exposure. In the beginning of March, the facility's emergency operations plan was tested via tabletop drills and secret shoppers. Response to COVID-19 was emphasized. Procedures were implemented to screen all visitors for recent travel and illness. Given the critical importance of limiting COVID-19 exposure, additional measures were implemented beginning on March 13th of 2020. In compliance again with CMS Public Health Action for nursing homes and New York State Department of Health guidance. Seaview has tracked and reported all suspected and laboratory positive COVID-19 cases through the implementation of effective infection control and prevention procedures, including cohorting residents and designating a COVID unit. The majority of Seaview residents were not impacted. Cases have been shared with the Department of Health on a daily basis, and most recently have been shared weekly with CMS and CDC via the National Healthcare Safety Network. Cases and overall COVID status have been shared with all Seaview families. A facility hotline number and weekly town hall conference calls were established for families to access regular updates. Alternative visitation methods, including virtual visiting utilizing iPads and scheduled window visits, have been very successful. Approximately 150 virtual visits and 60 window visits were conducted weekly. Individual family requests have been honored for resident birthdays, short visits through the lobby window, where residents remain inside with the mask and masked family members remain outside. Seaview allowing us to see a mom. This is a quote, by the way. Seaview allowing us to see a mom for her 80th birthday meant so much. It was a recent headline in the local Staten Island newspaper, quoting a Seaview resident's daughter who had not physically visited her with her mother for several months. Just if I can go on, there have been a total of 6 focused Department of Health infection control prevention COVID surveys conducted at Seaview. DOH survey is focused on staff knowledge and awareness, PPE availability, prevalence of infection and resident cohorting. Seaview has been found to be in full compliance with no deficiency. The generator project is complete regarding infrastructure and equipment. The Grace Foundation project is moving along as well. The residence rooms we are working on a plan. COVID-19 pandemic has had an alternate plan, and we are behind in manpower either through retirement or disability, and we are starting to get back on track. Our partners are working quickly, as well as our carpenters on this project. Oxygen storage rooms, locker rooms on the nursing units have been repurposed as oxygen storage for those particular units and is complete. A requisition has been processed to purchase a new camera system for the first dose room and the 8 medication rooms. Patient resident safety satisfaction. Seaview continues to implement the strategy to improve the patient resident experience. Overall satisfaction and final rating scores rank at above the 95th percentile rank when compared with other facilities in the nation. Areas of focus identified in the satisfaction survey were in activities and finance. And if I conclude, issues impacting the community served. I'm sorry, and I don't have a visual. I don't know if I have any time left. High COVID.
Yeah, it's just expiring, so thank you.
Okay,
you can conclude your remarks.
Yes. High COVID infection rates impacted Richmond County, designated the community as a yellow COVID-19 cluster zone for several months in 2020. However, Seaview has been able to keep infection rate lower than that of the county. So again, I'll just reiterate our appreciation of the leadership of Matthew Levy, and I apologize for Acting Chair George Marino for being unable to present this testimony, which I have completed on his behalf. Thank you.
Great. Thank you so much for your comments. And I understand we'll be hearing from you again in just a moment. But first we have another speaker, Michael Schnall, who is a candidate for New York City Council in the 49th Council District.
Good evening, Chair Pagan and Dr. Katz. My name is Michael Schnall, and I'm a candidate for New York City Council running to represent the 49th Council District, covering the North Shore of Staten Island. Thank you for this opportunity to testify at the New York City Health and Hospitals annual public meeting in Staten Island. First, I want to thank Robert Nolan for the many years of advice and guidance he's given me and his continued willingness to share his wisdom. And thank you to Dr. Vincent Calamia for representing Staten Island on the H&H board and for taking time to talk and share with me as I educate myself on how H&H can better serve Staten Island. As someone who's worked on all sides of New York City's budget battle, I know how important these hearings are for smart, thoughtful, and informed decision-making that inevitably impacts the health and wellness of millions of New Yorkers. So I want to begin my statement by being crystal clear with you. H&H has a long way to go before accomplishing its mission in Staten Island. And I'm here tonight to help clarify what I believe are the next steps for H&H to accomplish that mission. Well, H&H's mission is very clear. It is the public safety net healthcare system of New York City, and it's charged with three goals: to extend comprehensive health services equally to all New Yorkers, to promote and protect the health, welfare, and the safety of the people of New York City, and to partner with communities to promote and protect health in its fullest sense, the total physical, mental, and social well-being of people. I believe H&H has fallen short on every goal here on Staten Island, but I know that we can work together to improve and fulfill those goals. So over the last 2 decades, Staten Islanders have been distracted by messaging from candidates and elected officials alike that Staten Island must have a public hospital. Even this year's crop of mayoral candidates have started saying the same. I'm here to deliver a different message. Having worked for the city for over 14 years, I know how long it's going to take to rehabilitate or build from scratch a new hospital. And from what I've learned recently, if a new hospital were to be built, we'd surely lose one of our 2 nonprofit hospitals anyway. So knowing this, I'd ask this board to consider something different. H&H can provide services to Staten Islanders in lieu of building a new public hospital and bring those services directly to Staten Islanders. Let's claim the value of that hospital and its services owed to this borough and bring new and innovative services like telehealth or in-home doctor visits and mobile services. And now I'm not asking H&H to create those services from scratch since you're already providing them in other boroughs. And I believe in this post-pandemic world, government will work best when we bring services to taxpayers. With an inadequate transportation system leading to the longest commutes in the nation, Staten Islanders need a little bit of help reclaiming some time. So providing these services closer to home will go a long way to improving our borough's quality of life. H&H can play a real and meaningful role in improving the health and wellness of Staten Islanders and can start right now by bringing those services to people in a comprehensive way. See, I live to serve New Yorkers who are underserved and underrepresented, and I know you do too. So I implore this board to keep working to fulfill your mission of service to 8.4 million New Yorkers, and I look forward to being a partner with you in helping fulfill that mission. And thank you for the opportunity to testify. I look forward to hearing the rest of the Staten Islanders that will testify tonight. And I encourage you all to stay safe, wear a mask, socially distance, and get that vaccine when you're eligible. Thank you.
Thanks so much for your comments. Our next speaker is once again Joe Tornillo, this time representing himself as a former chairperson for the Community Advisory Board and the current president of the and CEO of Meals on Wheels Staten Island.
Actually, when I called earlier, it was to give testimony for on behalf of George Marino. So, I don't have a separate testimony to give. So I appreciate that. Thank you.
I'm sorry.
Okay. That's all right.
Sorry, just a misunderstanding. Thank you.
No, I called earlier and I thought that I had to disconnect it. That's why I called back in. Okay, thank you.
No problem. And with that, I think actually that is our last registered speaker has spoken. So at this point, I will conclude the meeting by thanking all the speakers so much for your contributions, and have a good evening, and please stay safe.
Benioski, that beard looks good, brother. Looks good. I see you.
Thank you. I see you. Yes, see. But I like yours also.
Yeah, I shaved mine down, but I'm digging yours, Dr. Calamina. It's a pleasure to see you as always, sir.
Same here. Thank you. I do like your beard. But Fenieski, I'm going to give you the higher grade on the beard, though, I have to say.
You see, I'm not dealing any longer with Otto, so I can take some relaxed time. You know, he gave me a lot of grief when I was in the city.